Welcome back. So, one of the readings that you were assigned to better understand social determinants of health is something called Frieden's Health Impact Pyramid. Frieden was the director, the former director for the Centers for Disease Control and Prevention. And basically, prior to actually proposing this pyramid, he was stating about how so many times, so much of the emphasis on public health has been on health education, and how there's also this real emphasis on health and healthcare access that is really not public health. That's more of medicine and healthcare delivery. But public health is really about the prevention and control of disease. And as individuals interested in helping to prevent and control disease, we really need to take the social determinants of health into consideration when making recommendations. And so he decided to create the health impact pyramid, which is what you see in front of you. So I want to first of all outline or look at the two arrows that we see. We see one arrow that says increasing population impact going down. And we say on the other side, we see increasing individual effort needed going up, right? So what I want you to do when you look at this pyramid is think towards the top. The higher you get to the top, the more the responsibility for living a healthy life falls on the individual. Whereas the closer to the bottom of the pyramid you get, the more that the environment around the individual and societal factors are being changed that make it easier for them to live a healthier life. The higher up you go, the less of an impact there is on population health. The closer you get to the bottom, the more the impact that you have on population health by making these major changes. I don't know how many of you ever remember Maslow's hierarchy of needs, but this kind of follows suit or the organization of that pyramid in Maslow's hierarchy of needs, where the larger needs, housing, an income, roof over your head, are housed at the bottom of the pyramid, and that as you achieve those bottom tiers of the pyramids, as you achieve those needs, you can go higher and higher up until you reach self-actualization. So this is similar in the sense of if you've got these socioeconomic needs met, like housing and a decent income and access to education, it's easier to live a healthier life. So I'm going to go through these tiers with you. At the bottom, so tier 1 is something called socioeconomic factors. Those again include a focus on housing, on policies that impact your income, such as minimum wage policies, um, you know creating child labor laws so that individuals under age that are underage aren't working long, strenuous hours so they can also go to school. Ensuring housing, try and create policies that really impact affordable housing. Zoning, so that there can be housing that's you can zone certain lands to say, people can live here, people can't live here, right? So those are just some of the policies that would be examples of socioeconomic factor, I guess, interventions at that level. The next is changing the context to make individuals' default decisions healthy. That's how can you change either the built environment, so putting something and constructing something and putting it in someone's environment to make it easier to live a healthier life. The example about how the natural environment's been changed to promote health that's given in this article is fluoridating water. Originally, people fluoridated water and even put trace amounts of chlorine in it in order to help prevent dental cavities, right? And dental and just to promote dental health. And so that's why that fluoride was introduced into water to try to change that context, make it easier for people to have better dental hygiene and health. This could also be something such as introducing some type of intervention or some type of resource into someone's environment to make it easier for them to have a healthier lifestyle. It could also be something like removing lead from paint, so that kids aren't getting lead poisoning. Removing lead from gasoline, right? So that the exhaust from leaded gasoline doesn't damage your central nervous system, right? Those are all parts of changing the context. How can you change that environment or built environment around an individual to live a healthier life? The next is long-lasting protective interventions. These are those one-time shots that you can enact for people to have a longer-term health outcome. The best example for long-lasting protective interventions are vaccines. My particular area of research is the HPV vaccine. You get this vaccine, complete the vaccine series at around 11 and 12, and also prior to sexual activity is the best time, but you can have had the HPV vaccine after engaging in sexual activity or after sexual debut, right? That will help prevent and control genital warts and certain cancers down the line, right? So by doing this one thing, you can really help try to guarantee that someone can prevent and control disease later down the road. The next are clinical interventions. Think about that as someone checking in with a healthcare provider on almost an ongoing and regular basis to enhance their health. That could be, someone with diabetes checking in with their healthcare provider to make sure that they're monitoring their blood sugar levels, right? Their insulin's being monitored over time, that their toenails are being clipped as needed so that they don't run the risk of puncturing, having wounds that might lead to further amputations later down the road. This could be a regular ongoing checkup with a primary care provider. A lot of my research also previously has been with patients or people living with HIV. And so going in and seeing your primary care provider to check your immune functioning and also your viral load is something that people living with HIV do on a somewhat regular basis. And last but not least, and I think this is what's absolutely critical, what has the least, that it requires the most amount of individual effort, but has the least amount of impact on a population, is health education as well as ongoing counseling. It's a very one-on-one type of interaction where there's some type of healthcare provider and an individual. And again, it really puts the responsibility on that person receiving care to help prevent and control disease, right? So you're helping that individual on a one-on-one basis, but it often takes the least amount of policy change, so it could be seen as low-hanging fruit, right? But at the same time, it really doesn't have that huge impact on a population as changing those socioeconomic factors. So you can tell people, again, be physically active, but maybe you could do something that would change the context around their lives. Ensure that there's a safe place for them to be physically active, that there's lighting, that there's a safe sidewalk to walk on, that you help invest in parks and recreation around where individuals live so that could create the green space for them to be more active, right? That would be targeting lower tiers on this health impact pyramid that could help create the change that you're looking for. So I want you to keep these in mind because, again, when you're focused on the social determinants of health, you're more interested in these lower 3 tiers, but really the first 2 tiers. And what can we do to target those socioeconomic factors and change something about changing the context of someone's life in order to make it easier for them to enact healthy behaviors? All right, that's all that we have for this particular part of the lecture.